It is Thursday, so that means we are joined in our KSAT Q&A section by Dr. Ruth Berggren from the Long School of Medicine at UT Health San Antonio. Of course, we're going to talk all things COVID-19. Thanks for joining us again. Doctor, I think the big question I have, we've seen the CDC start to relax some of its guidelines, mainly on masking. I was out at some big box stores today in the last few days, seeing a lot of people not wearing the masks anymore. Is that where we should see, should people feel pretty comfortable now at this point going around without masks?
So I'm really delighted to report that we are finally below 5% on our community positivity rate. That's a huge step. And so the risk truly is mild in our region right now. And the number of cases per 100,000 is down to about 13. That's a low level. And it is reasonable to relax masking when the risk is mild. And I have a caveat. If you are an unvaccinated person, if you are a person at high risk for COVID complications, and we know that that includes people over 65, you want to be still a little cautious by masking when you're in indoor crowded places. I myself will continue to wear a mask when I am in an indoor crowded place, such as in a church or a concert hall or an airplane. However, when outdoors or when indoors in places that aren't very crowded, where you have reason to believe that most people are vaccinated, it's okay to be unmasked there. And that's what I would recommend to others as well.
Dr. Berggren, with the variants, obviously we just dealt with Omicron. Are there other variants around the world that we really should be keeping an eye on?
So it could happen at any time. A lot of people have heard already about the BA2 subvariant, being called the stealth Omicron variant. And while it is even more infectious and more highly transmissible than Omicron itself, it really doesn't seem to be that big of a concern for us in terms of its deadliness. And fortunately, prior vaccination and or prior infection with the original Omicron variant seem to be providing a protection against this variant. So that, together with the fact that we have new antiviral drugs that are available to us in more plentiful supply, mean to me that we shouldn't be frightened of the stealth variant. And of course, we also always need to keep an eye on it and any other variants that might emerge. And they could always emerge from places in the world where vaccination rates are low and population density is high.
So a lot of people here now are able to get the vaccine, but we still have that age group of 5 and under. A lot of parents still concerned about that age group not being able to get the vaccine. What are we hearing on that front? Are we getting any closer to approval for the shots for 5 and under?
Right, so that's being studied, but unfortunately we have no clear timeline. For the 2 to 5-year-olds, the data were not very good for 2 shots. The 2 shots from Pfizer was insufficient to protect 2 to 5-year-olds from COVID-19. So Pfizer is now compiling data that they will hopefully submit in the not too distant future, looking at whether 3 shots will now protect the 2 to 5-year-olds. And at the same time, Moderna is looking at data from a higher dose administered in a 2-shot series for that age group. So we're working on it and we're waiting for data, and the timeline is not yet clear.
And just to follow up on that question real quick, since we're talking about vaccines, Bexar County has had a pretty low rate of the booster shot, folks getting that. How dangerous is it, or what are the complications if folks aren't getting the vaccine and the booster still at this stage of the pandemic?
So I would obviously recommend that everybody follow the guidelines and get the booster. What we don't know is where in the world another variant will come from and when it might show up. And the thing to keep in mind is that just going out and getting a booster doesn't immediately protect you. It takes usually 7 days, and it may even take up to 14 days for you to get the full protection from your booster. So my recommendation is don't wait till the last minute. Go and get boosted now.
All right. And finally, I know it's kind of a tough question to answer. We talked about it in the break. Many people are wondering, will there be a period when we can say we're finally out of this? Not even close at this point, as far as your opinion goes.
You know, that's tough to answer. What we all are dreaming of is clarity, that we'll be able to predict what kind of vaccine we need within 6 months in advance, kind of like we do with the flu, right? We're all used to getting our flu shot once a year. We know we start getting it in September or so. And generally, there's been some kind of way to predict what's needed in the flu vaccine. That's where we want to get. And we have a long way to go before we get to that stage with COVID-19.
Is there any hurdles right now that health professionals are dealing with when it comes to the pandemic and still either trying to spread the word or convince people to get out there and get vaccinated?
Yeah, I would say the biggest hurdle that we have is that there's been a bit of an undermining of trust between the health professionals and the public because the messages have been so confusing, including for us. First, we're told to mask, then we're told not to mask, then we're told to mask again. And so people feel like they don't know what to think. So the big job that I face as a health professional and a health communicator is learning better how to communicate health information as it becomes available in a manner that is clear and trustworthy.
All right, we will continue to deal with this, and we will continue to reach out to you on Thursdays for your excellent advice. Dr. Ruth Berggren from the Long School of Medicine at UT San Antonio. Thank you so much for your time.
Good to be with you.
We'll be right back.